And catching COVID more than once appears to raise the risk of developing new health problems. Here to explain his concerns is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Always good to see you.
Dr. T, it's great to see you. So researchers have reviewed more than over 5.6 million records for patients in the VA system. So first question I'm going to ask you, because I don't know, is that a large study? Yes or no? Is that a large study?
That is a large study.
Okay, so what are we learning from the results of what would be a large study?
Right, so remember, there's been an adage that if you get COVID more than once, the next recurrence is likely to be more mild. And this study really calls that into question. It's a large VA study conducted in St. Louis, and it looked at over 5.5 million patients. Most of those patients were in the control group. They never reported a history of COVID. There were about 250,000 patients that were studied that had COVID once, and about 38,000 that had it 2 or more times. And what they showed is that each time you got COVID, there was an increased risk of hospitalization and death. Now remember, the absolute risk was still low, so most patients with COVID, even patients that are at high risk, still do well. But you know, this did call into question the fact that we really do have to protect ourselves. We don't just want to say, oh, we got COVID once, we're going to be fine each time. Remember one more thing, this is a VA study. Right. So this is going to be an older patient population. 90% of these patients were men, and of the people who died, most of them had multiple comorbidities. So, but I think that it does say that even patients that were vaccinated, it didn't really matter what their vaccine status was, you still had similar results. So again, hopefully the next generation vaccines that we see in the fall will be even better.
Okay, and we know you treat COVID patients every day at South Shore. Are you seeing more reinfections?
Jessica, we definitely are seeing more reinfections with this BA5 and BA6. Really, in the era of Omicron, we have seen them. With that said, we're not necessarily keeping track so much of, which patients have gotten it in the hospital. It doesn't really change our management. In the outpatient setting, we are seeing increased cases as well. Although the good news is most patients who are getting this don't even necessarily have to even call their primary care provider because most cases are mild.
Dr. T, the COVID vaccines that we have now do I don't know if this is fair to say, so if it's not, please correct me, but do the vaccines do a better job protecting us against hospitalization and death than they do against the infection? And if so, is that part of the problem?
It's really important that you said this. The vaccines are doing an excellent job at protecting us against severe illness and death. I know you're probably shaking your head saying, but what about that VA study? We saw increased risks of death even in patients who are vaccinated. Remember, both can be true. I think what's important, though, is we do want to do a better job at preventing infection. These vaccines that you inject in the muscle, they really help us with antibodies around in our body, but in the mucosal membranes in our nose and mouth, you don't necessarily get as high of a degree of immunity. So right now, scientists are working on mucosal vaccines, COVID sprays that hopefully one day, maybe in conjunction with these shots, will help us prevent infection better than we're doing.
Okay. All right. I got to ask you this as well, because we know about 5% of adults in Massachusetts are unvaccinated. What do you want them to know about the risk of getting COVID again and again? You touched on it a little bit. Just kind of explain a little bit more.
Remember, the vaccination is not just about life and death. There's long COVID. There's patients who have lost their sense of taste and smell for months and even years now. So the vaccine hopefully can decrease the risk of that. We know in studies already that vaccines do decrease the risk of long COVID. But I think there's a lot of benefits that are not even just in life and death. So for those 5% of patients, I would say go ahead and go out and get vaccinated. We also know that hybrid immunity, even if you are infected after you're vaccinated, the good news is that is a strong immune defense when you get a combination. So it's not too late to get vaccinated.
Dr. T, it's great to see you. Thanks for your